Could you still remember where were you and what you are doing in the second week of March 2020? Now, we are in the year 2022. This same week, 2 years ago, no one knew that would be our last normal week. Classes are then suspended, transactions are halted, and more restrictions have been implemented. Our routines have been affected. Life has never been the same, all because of coronavirus 19. COVID cases all over the world have been rapidly increased, and for once, Cebu City has been a hotspot for this deadly virus. The fear, risk, and damage that it can cause has been very dangerous, especially to the vulnerable population, which includes those with comorbidities and the old and young people. In the Health Technology Assessment report that can be found in Department of Health Philippines website, it has been noted that COVID-19 cases and hospitalization among children 5 to 11 years old contributed 3.49% and 0.06% of total COVID-19 cases. In the Philippines from March 2020 to January 2022, respectively, with a notable increase during the Omicron wave observed in January 2022. Now, 2 years as we live with COVID, vaccines have been formulated and made available as our form of protection and a major step towards pandemic recovery. In the Philippines, the government's vaccination program started last March 1, 2021. Following a list of priority groups to be inoculated. With its exercise, COVID cases, especially the severe ones, started to decrease. The hospitalization and mortality rate reduces as well. Restrictions were gradually lifted and people's mobility has started to improve, except for young ones. For a long time, minors have been encouraged to just stay at home. Aside from their vulnerability, they were also not yet eligible to receive COVID vaccine during the pioneer implementation of mass vaccination. Though finally, in the first week of February this year, the Philippines officially began the vaccination of minors as early as 5 years old. The Food and Drug Authority granted the emergency use authorization of Pfizer and Moderna, certifying the brand safety and efficacy to be used by the said age bracket. To complement its target recipient, these vaccines were adjusted with different dosage, formulation, dilution requirements, doses for administration, and storage condition suitable for children. It is also important to note that experts and reputable sources from the Philippines Pediatric Society and Pediatric Infectious Disease Society confidentially voiced their support, stressing that it's also important that parents discuss with their healthcare provider. Intended vaccination sites for children are also designed to create a friendly atmosphere. Venues were turned into cartoon-themed environment filled with mascots, sweet treats, and healthcare workers dressed as different cartoon characters. These are commendable government and healthcare efforts that we must appreciate and support. For interested vaccines, pre-registration are highly encouraged to ensure crowd control. Forms are available online via Vaccination Information Management System of each respective local government unit. Requirements include the child's ID and birth certificate. For the accompanying parent or guardian, they must bring valid ID or affidavit of guardianship. For children with comorbidities, its physician's medical clearance is also required. Aside from getting vaccinated, let us also do our part by properly educating ourselves to know more. Information is very much available at Department of Health website and to every local government unit's public information office. Let's live responsibly. Let's achieve herd immunity. Let's do our part for this world to be COVID-free.